Abortion care on campus is important to me because campus health systems are designed to be comprehensive. They're supposed to take care of all of your needs while you're enrolled at that university. They do physicals, STI testings, vaccination, even mental health appointments. But when it comes to abortion, I've noticed that the support stops. And that service gap sends a message. It tells students that some needs are too controversial to be acknowledged, too controversial to be met. And that message has material consequences on students today. It causes delays, confusion, stress, and isolation when accessing abortion care. I've seen people have to recover from procedures alone in shared housing with limited access to follow-up care, no flexibility, no transportation, no one to call. Students may fall behind in school trying to coordinate appointments, manage their reproductive health care, and balance academic obligations. And these aren't rare exceptions, but they're patterns created by institutional silence. Abortion care on campus isn't an extra. It's necessary if students are going to stay in school, manage their lives, and be treated with dignity.
Abortion care on campus is a big deal because students shouldn't have to jump through a million hoops to get to the healthcare that they need. College is already stressful enough. Throw in financial struggles, no car, and a packed class schedule, and suddenly getting to an off-campus clinic feels like an impossible side quest. Having real access to abortion care, or at least solid resources and referrals, means students can make the choices that are right for them without unnecessary drama. It's about autonomy, dignity, and making sure that no one's education gets derailed because they couldn't access basic health care. Plus, let's be real, reproductive rights are human rights, and campuses should be leading the charge in making sure students have what they need to thrive.
Abortion care on campus is important to me because I had an abortion during my third year of college. I lived on campus that was 2 hours away from the closest abortion provider. What if something went wrong on the day of my appointment? What if my partner's 13-year-old car didn't start? What if the doctor couldn't arrive from the Atlanta airport? What if we had to reschedule and I didn't have a free weekend due to my duties as a resident assistant? My abortion allowed me to graduate with my bachelor's degree, and now I'm a graduate student in a public health program. Abortion care on campus addresses those concerns. Offering medication abortion on campus would allow students to safely terminate their pregnancy in a private and comfortable setting with the support from a trusted friend.
Abortion care on campus is important to me because it is an essential resource that ensures that all college students feel safe, supported, and protected, making the best decision for themselves. Access to abortion care on campus ensures that all students feel fully supported during a time that's already emotional and challenging. One of the biggest challenges that we faced for establishing this is resistance from various groups such as administrators, faculties, and even students or student groups. Another major hurdle that we've found is lack of awareness and outreach. While abortion care may be available on campus, many students remain unaware and don't know that these resources exist.
As access to abortion, contraception, and gender-affirming care is becoming increasingly restricted and threatened across the United States, college campuses have the responsibility to serve not only as basis for intellectual growth, but also as a haven for essential reproductive health care. For students who may not be able to access an abortion in their home state or would have to sit on public transportation or drive for hours in order to access an abortion, campus clinics present the opportunity for care that is localized and proximal to a student's chosen community.